Everyone, and welcome back to my channel e-nursing once again. So this is video presented to you all to understand the medical examination process for the MNS SSC recruitment 2024. So there may be lot of queries as this is going after a long time. What will be done in examination test in medical? So the list of test is a very long, but this video is presented to you all to clear your all doubts, like what is the requirement of height, weight, vision, and what if there is undergoing pregnancy, and etc. So I just wanted to say quote, think positive and be positive by working hard, and then you will achieve your goal very soon. So with this quote I would like to start examination. So on this slide you can see this is the very basic information and the doubts that you all are going to face whenever your letter will come for medical examination. So when it will be done? So after written test your result will be uploaded on your site or ID of the NT agency. Then they will call you for the interview, and as you will clear interview on the same day, they will tell you that your medical examination will be done from tomorrow onwards, means one day after the interview. So it will be done just after the interview. So like if you are going for interview and staying in Delhi, then be mentally prepared that if you will select it, then you have to stay there for 5 or 6 days more, because it is a long process. And don't worry about the examination. This is the basic examination just to screen the body. It is not too difficult, but the list of test is quite long. So it will take time 5 to 6 days. 5 to 6 days may take. It may take 4 days also, 5 days also, and 6 also. So at which place it will be held? So at as interview will be conducted in Delhi. So there are only two military hospital. First is base hospital in Kent, then another is AHR&R, Army Hospital Research and Referral. So these are the two places where medical examination was done in 2017. So most probably medical examination will be conducted there only at two places. So half of the candidate will be sent to Army Hospital R&R, and other 50% will be sent to base hospital in Delhi, Kent. So try to find a place or hotel or PG, whatever. If you are having a relative, that's good, near this area only. So then accommodation facility. So they at this stage they don't provide any accommodation. You have to arrange by your own. Then timings. Timings are as working hours start as 8 o'clock. So they will call you at 8. So by sharp at 8 you all should be present there. So one one MNS officer will be there uh, to check you all for your presence, and not only one, maybe two or three officers will be there, and they will see whether you have reached there on time or not, and then they will guide you how to and where to go for the medical examination. Then duration, as I have already mentioned that the list is very long, so it may take few days, that may be 4, 5 or 6 days. Then after the completion of the test, final result will be declared by the presiding officer. Presiding officer is the senior most officer of the medical board. Then by chance if you are lacking somewhere in the medical examination and you are not fitting there, for example, the ideal weight for being medical fit is 50 kg, but your weight is 58 kg. Then medical fitness deadline will be given to you, and that will be for 40 days. 40 days. So what does it means? It means that after 40 days you have to come back to the hospital after decreasing weight. So they will measure your weight again, and they will mention it in your medical documents If the weight will be same or increased, then you will be rejected, and if you will be able to control or lessen your weight, then you will be fitted for that, and it will be recorded in your documents. The next is who will guide you. So it is, I have already said that there will be MNS senior officer, and you will interact with them by face to face, and they will be able to see their uniform and the behavior or dedication which they carry throughout the service. So they only will guide you, and as you will meet them in person, so you can also ask for the experience, their experience in military nursing services, as per the situation, if you feels to do so. So this is the basic information about the medical examination for the MNS SSC recruitment 2024. So this is the list of tests which will be conducted. So first is physical examination, means routine physique will be checked whether you are normal, very thin, very obese, and it include breast examination, as only female candidates can apply, so it is necessary to do this. So this will be done. Then vital sign will be assessed, height and weight with BMI, vision, dental examination, hearing test, posture, knock knee, flat feet, carrying angle and gait, X-ray chest, ECG. They will ask you about menstrual history and pregnancy. Then ultrasound, whole abdomen, blood and urine test, or any genetic or acquired disability. So this is the list or index which has mentioned all the examination which will be conducted. So one by one on coming slide we will see these in detail. So we will start with physical examination. So on physical examination, so first means it is not written in the slides, as per the serial number it will be done. So for some candidate blood test may be done first, for some candidate height or weight measurement may be done first, for some candidate ultrasound may be done first, for some another, for other candidates extra X-ray will be done first. It is because that the number of candidates will be higher, and as both hospital are busiest hospital of the military, and as Delhi is crowded area, so normally more patient goes there, so it will be difficult for them to conduct X-ray or ultrasound or blood test of the all the candidate on the same day. So you will be detailed according to that by the guiding officers. So serial number are not exact known, but all the test will be conducted. So first is chest expansion on inspiration. Inspiration means it is exactly not on inspiration, it is after inspiration, as you have inhaled air or you are normally standing. Then and after that chest expansion on expiration. Then expiration means you have taken breath and you have exhaled air from your mouth, then your chest will be measured like it is seen, it is shown in the screen, in a screen A. So like this inchy tape will be placed and your chest will be measured. Then after that you will inhale the air. So this is on expansion, then this is you will inhale air, and after that your chest will expand as lungs will be filled with air, then they will also measure this. So this is pre-expansion and this is post-expansion of the lungs. So for women, as it is given in the table, so this difference will be noted. So this will measure, actually these values are not fixed because every candidate have different physique and different sizes of their body, like some are obese, some are very thin, some are lean, some are not. So it may vary according to person. So they will look for any general impression, like if you are looking pale or any visible anomaly, like if somebody has like deformity in the ear lobe or at face or eyelid or at any other place of the body. Then they will ask you to write the family history of any disease. If your genetics are running any medical condition like hypertension, blood pressure in your first degree parents, so then you have to mention that also. This point doesn't will matlab, lead to decrease your points, but just for information they want to know that whether your family is having any disease condition or not. So this was about the physical examination. So then next is vital signs. So this is the first thing we all do as any patient or sick come to hospital. Then we will take vital signs that include temperature, pulse, respiration, and blood pressure. So they will check. Then history of illness. If recently you have undergone any illness like dengue fever, chikungunya fever, viral fever, or any disease, so they will ask. So if there is anything, then you have to inform. Then next is body mass index. So this is a uh, criteria about which many people are confused. So I will try to clear this. So first is height. Height and weight is always measured according to the age. So like this is height given in the centimeter. Like first is 148 to 151 for the age 20 to 25 years. So what will be the age? Weight 43 to 45 kg. And it is not like that if your height is 150 and your weight is 46, then you will not be rejected. There is always plus and minus 5 kg which is acceptable. Like if your ideal weight should be 43 and if you are 38, then you will be passed in the medical examination. If your weight is 37.5, it is more than 5, that is less is minus 5.5 kg, then you may be rejected or you will be put under deadline, medical fitness deadline. So this is how it is measured. Same as height increases, so weight also increases. And the most important thing with in relation to height and weight is normal body mass index. As you all have counted your body mass index in the student time, so there also according to the your age and height you all have to count. So BMI formula is weight in kg divided by heights in meter squared. So and normal should be 23. So this was about the body mass index, height and weight. Then we will see vision test. So some people thinks that if you are having specs they will not take you, but it is not like that. Your acuity should be 6 by 6 with specs on Snellen chart. So like this is the Snellen chart. So they will make you sit on a chair and then you have to see and identify the alphabets, then your acuity will be measured, but there should be no color blindness. So this may be a cause of rejection, and if there is any genetic anomaly related to vision, so this may be a cause of rejection. Otherwise you will be fit in this. Then dental examination related to this also there is a lot of confusion among candidates. So first thing that they will check for is the presence of 32 teeth in the oral cavity. So if you are having less like 30, 31, 29, so they may it may lead to a negative point. Otherwise 32 with 32 teeth you will be fit. Then no pyorrhea or cavities should be present. If it will be present, then you will be put under medical fitness deadline. Then dental fluorosis is acceptable. Like in some parts of India, water is not able to, means quality of water is like this, it is not good for drinking, but because of the lack of resources some people are consuming it, so which may lead to dental fluorosis. And if any of you have fluorosis, then they will not reject you. So medical in dental examination, dental fluorosis is a no is not a cause for rejection. Then next is hearing test. Hearing test will be performed in a soundproof room to measure accurately. Then which test will be conducted? First is known as pure tone test. So to identify tone at various species. So like one person will be sitting here and they will make you sit into another room, or they will put a screen in between. This photograph I have taken from internet, but exact it may not be like this. They may sit you, they may make you sit behind a screen only. So there one person will be standing there and he will speak the various words at various pitches from low to high, and they will assess if you are able to listen them or not. So then a word recognition from background. So this is to check the, like if to uh, in this also you will be put behind the screen and then 2-3 people will speak to one another. Then you have to identify or tell the words which they have exactly told. So some voice may be of very low pitch, some may be of very high, so they will see if you are able to understand that or not. Then next is tympanometry. So tympanometry is done to examination the tympanic membrane. So they will see for the earwax and if there is perforated eardrum, if there is anomaly or infection in the ear. So this is all for the hearing test. Then next is orthopedic assessment, which includes assessment for scoliosis, kyphosis and lordosis. As you can see in picture, this is normal spine, and if this part is bent like this is known as kyphosis, and lordosis is like this, and scoliosis is like this, sideway sideway tilted spine. So 8 to 10 degree of abnormality is acceptable, but if it is more than 8 and 10 degrees out of any these, then it may give you a negative point. Then knock knee, you can check it while walking, that you should not have knock knee, there should be some gap between both the knee. Then normal carrying angle, this is angle between elbow and body, so this would be 5 to 18, and if it is more, then it is known as cubitus valgus. So if you have this, and this is same is done for the heel also, which is known as heel valgus. So if this angle will be more, then you may be rejected for this. Then for flat feet, by genetics or by birth only, some people don't have this curvature, they don't have some space, their feet directly touches the floor, which is known as flat foot, and it will give a footprint like this, but this is a healthy foot, so they will check you for this also. Then next is X-ray chest to rule out any active or passive disease condition. Chest X-ray will be done, so to see that if you are prone to any medical condition or not, if you are if you have gone through any pneumonia or any major diseases like tuberculosis or anything, so they will get done x-ray to rule out this type of condition, or they can also see any if any type of fracture is there in clavicle, ribs, or the area which include the chest. And for cardiomegaly also, and the position of the heart, it is at normal position or it is dextrorotatory position. So x-ray will be done. Then electrocardiograph for assessment of cardiac health, so they will check pulse rate or PQRST wave pattern in the ECG. Then next test will be done is ultrasound whole abdomen means lower and upper abdomen all will be included. All the vitals or organs present in the peritoneal cavity will be assessed, like they will be checked for cholelithiasis, renal stone, or any cyst, or if you have recent had any fever, so they will see for splenomegaly, hepatomegaly, or fatty liver, means anything that lower appendicitis or appendix is present or not. So ultrasound will be done. And one more thing, they will assess in presence of the pregnant uterus. So this will be done. Then next is menstrual history. So for being a female candidate, so this is the most important history which they will ask for. So menstrual history include at which age you had your first menstrual cycle. So this you have to write there. Then duration means for how many days you had your normal periods, like some have for 3 to 5 days, some have 5 to 6, and if it is more than this then that will be abnormal. And pattern and regularity, some have pattern of 28 days, 31 days, some have 45 days. So 28 to 31 days of menstrual cycle pattern is normal, and more or less than these is early or late pattern or late cycle. Then this is what will tell about the regularity of the menstrual periods. And one more thing is menstrual pain, some have more and some have less, but they don't ask for it. So every body has different physiology, so sometimes some have more pain and sometimes they have lesser pain, so it doesn't matter. Then menstrual history after delivery, if you are blessed with a baby, then after that it has affected your menstrual period or not, then they will ask for this. Then history of pregnancy, if married, if you have got how many times you have got pregnant and how many times you have undergone through delivery, or present pregnancy may be a reason of rejection. So at the time of the medical examination, a female candidate should not be pregnant because being pregnancy they cannot be put under medical fitness deadline, because that is only for 40 days, but duration of gestational period is more, as you all know. So if there is any present pregnancy during the medical examination, so this may be a reason of rejection. Then next is, if you have gone under uncomplicated vaginal delivery, then only after 24 weeks you will be considered fit, and same like MTP or abortion 12 weeks after this. And if you have gone through lower segment cesarean section, then 52 weeks following you will be considered as fit candidate for the medical examination. So then we will see blood test. It include complete blood count, liver function test with enzyme, renal function test with electrolytes, total lipid profile, prothrombin time, international normalized ratio, thyroid test, then HIV, hepatitis B antigen, and hepatitis C viral infection. So this is the basic blood test which will be conducted. So then next is urine test. So urine test, in urine random or morning examination will be done. Then specific gravity will be measured, which is normal in 1.005 and 1.030 range. So this will be under this. Then urine pregnancy test will be conducted to rule out if there is any pregnancy or not. Then you will be asked for any genetic or acquired disability may be a cause of rejection. Like by unfortunately, if you have gone through any accident, you have lost or have deformed extremities or any body part in body, then you may be rejected. If you have polio since childhood, so it may be a cause of rejection. And if you are having speech problem, means you are not able to communicate with the other people, and which is very necessary. So these, any of these may cause reason, may be a reason of rejection. So then after all these long list tests will be after this test, then presiding officer of medical office, it is यहाँ पे आएगा medical board, it is mistyped. So presiding officer is the most senior officer of the medical board. After that he will sign your document and he will give remarks based on your test that you are fit for the medical examination or not. And then after he will take you as fit, then congratulations, and you can join and become a commissioned officer in military nursing services. So after checking your fitness, a list of candidates will be made and interview or calling letter will be sent to you. And one more thing I would like to tell you, that last time during document verification, then they have asked for a envelope on which stamp of around 42 rupees, which was pasted by the candidate, and her own address they have written by their hands, and on the same envelope they all have received their appointment letter or joining letter. But I don't know what this time what they are going to do, because all procedure is going to be online. So it may come as a mail only, or it may come by hand also. So it depends on them only. So this was the all on in detail on information about the medical examination for military nursing service recruitment 2003 to 2024. If you are still having any doubt regarding medical examination, so you can ask in comment. And thank you for watching this video. All the best.